Universitas. Importantly, in this beautiful moment, I would like to welcome Professor Albert I. Wertheimer, Ph.D. M.B.A. from Nova Southeastern University, Florida, the United States of America, and also his wife. Good morning. It is nice to have you here around us today. And also respectable all guests and participants of this webinar. Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. First of all, thanks to the Almighty God who has given us mercies and blessings so that we can attend this agenda in healthy condition. I would like to introduce myself. I am Andi Alia Yusria, will be your master of ceremony this morning. Ladies and gentlemen, welcome to today's event, High Impact Research Webinar about outcomes research and publishing findings. And I would like to thank everyone here for making time to attend this event. On this occasion, allow me to introduce you to the agenda. The first is welcoming speech. The second is opening speech. The third is the main agenda, which will be delivered by our invited speaker and also discussion. The fourth is photo session, and the fifth is closing. Ladies and gentlemen, the first agenda would be a welcoming speech. We invite the Dean of Faculty of Pharmacy to deliver her welcome remark. Please welcome Professor Dr. rer-nat Marianti Anggreni Manggau, pharmacist. The time is yours.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Honorable Head of Research and Community Service Institute, Professor Nasrum Massi, Honorable our guest lecturer, Professor Albert Wertheimer, all vice deans, all professors, lecturers, and undergraduate, master, PhD students of Universitas Hasanuddin, especially from Faculty of Pharmacy. First of all, let us give thanks to the presence of Allah for the grace so that we can gather here online and offline. On behalf of Faculty of Pharmacy, I would like to welcome Professor Albert Wertheimer from USA and all of you on this high impact research webinar with theme outcomes research and publishing findings. This webinar is important for us, how to choose good research that can be published in high impact ranked journal, and also which publisher is suitable for us, our manuscript. It is, I think, our mainly problem. Prof. Wertheimer is the right person because he is the author of or editor of 40 books, numerous book chapter, and more than 400 journal articles. His field of research is related to pharmaceutical counterfeiting, off-label prescribing, and cost-benefit studies. Prof. Wertheimer has German ancestry and has a German family name. Wertheimer means people who deserve to come home.
Wow.
I'm happy because I can speak German with him.
Oh, yeah. Oh.
Yeah. This year, we had already organized 6 guest lectures, 3 online lectures, namely from University of Belfast, and 2 from University of Saud, Hungary, and 3 offline guest lectures from Germany. At the end of this year, we have the webinar of Professor Wertheimer. Even though he came personally to us to Hasanuddin University, his lecture will be delivered hybrid, online and offline from research and community service institute office for accessibility to all of us. Prof. Wertheimer came by invitation of Fulbright specialist from the US government, thanks to the effort of one of our potential lecturer, Anshar Saud, and supporting from Professor Nasrum, Massi, as a head of Research and Community Service Institute, and also from our rector and all vice rectors. Professor Wertheimer is here from 1st to 13 December to share, teach about social, behavioral, and administrative pharmacy. I hope Prof. Wertheimer feel at home in Makassar. For all committees who has organized this webinar, especially Pak Anshar Saud, we thank for your effort not only to organize this webinar, but also to be a good host for Professor Wertheimer. And for all the participants, enjoy this event. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Thank you very much, Professor, for your delightful speech. Next agenda would be an opening speech. We invite the head of Institute for Research and Community Service, Universitas Hasanuddin, to deliver his opening remark. Please welcome Professor Dr. Muhammad Nasrum, Massi, Ph.D., Clinical Microbiologist.
Yeah, thank you very much. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, everybody. And at first, the Honorable, our Dean, Faculty of Pharmacy, and all leader in the Faculty of Pharmacy. For today, we have a webinar related to the pharmacology, and especially for the Honorable, our guest speaker, Professor Albert, Wertheimer, yeah. Sometimes I cannot.
Close enough.
Yeah, I'm very sorry because I'm not a German.
It's okay.
Thank you very much for coming in the institute as our guest lecturer, and with his wife. Thank you for coming, and this is the second time we met in. And thank you for Dr. Anshar who arranged this webinar, I think. As at the first, I want to say that this Institute for Research and Community Services is one of the institutes in Hasanuddin University who focus in research actually, and we try to increase our research activity in this building, yeah, because we have a study center, more than 23 study center in here, and there is a 2 division who arrange internationalization and public administration. So rectors give us the target to reach the outcome of the research, yeah, especially for the publication. This year, actually, we hope that we can reach the target 2,500. Scopus.
Oh.
Last year we can reach that one, but this year I don't know, because of the condition of the funding, yeah, from the ministry, so we cannot reach until 2000. Hopefully that next year we try to try hard to get that one.
Inshallah.
Yeah, inshallah. Wow.
Inshallah.
Good. We understand now. And yeah, because of funding, especially for the scheme, so that's why we try to change our scheme for the research. We focus on research fundamental collaboration. So all researchers in university should have a collaboration between their study program, in between faculty, and in between university. Even inside or outside university. So by this activity that we can invite speakers from abroad, especially from Albert, who will talk about outcomes, research, and publishing findings. So we are very happy to have that one, because we'll be support our activity related with our target. Yeah. We have many journals, but not all. More than 80, I think, we have a journal. But the level is national, but international we have, especially Scopus level until Q1 we have. Yeah, in Faculty of Forestry, there is a one, and another from Faculty of Agriculture. I think one more will be Scopus in Faculty of Dentistry, hopefully. So with that facility, we can try to increase our collaboration and publish together, and hopefully that we have get many funding, not only from our university, but from the ministry and from another international grant. That's why we have many activities related to that. High impact podcast to invite many our researchers who talk about what their topic, and after that we running for the this kind of high impact research. And we have international conference, yeah, almost every faculty who have to running this conference. So many foreign scientists we invited to be a speaker for that. So one of that is our guest now from Albert. So that is, I think, our activities related with the target to reach the outcome of our institute. Thank you very much for the Prof. Albert to come in here and to give share your knowledge, and maybe we can continue our collaboration not only for the given lecture, but we hope that in the future we can have a collaboration in research. The same, we can make it proposal together to get the international funding. Hopefully like that.
I hope so.
Yeah. Thank you very much. And because of the community asked me to open this webinar, so let's together say Bismillah.
Bismillah.
On the name of Allah, we can open this webinar together. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Ini.
Oh, ya.
Thank you very much, Professor, for your delightful remark. Ladies and gentlemen, now we proceed to the main agenda. This session will be delivered by our speaker, Professor Wertheimer, and also this agenda will be guided by Anshar Saud, S.Si, M.Farm, pharmacist, as the moderator. Ladies and gentlemen, now please welcome the distinguished speaker and moderator. The time is yours.
Okay. Thank you. Well, how do I get this up on the? Yeah, I will share screen. Okay. But first, I want to. Please. Gimana downloadnya? Oke. Okay, thank you, Ms. Alia, Dr. Alia, for nice introduction. I'm here to be a moderator for our guest speaker, Professor Wertheimer. And also we would say thank you very much to Professor Nasrum Massi for your kindness to us to use this building, this rooms, this beautiful room, and also your policy about high impact seminar for our honorable guest from Southeastern University. I would say also thank you to Dean Marianti and also Dr. Joaquim Masera, Ph.D. for accompanying with us today. And also thank you for all participants, our students. Most of them are I being the advisor of their undergraduate thesis, our students, and some of them are master students. Thank you very much for coming here. I want to, before Prof. Wertheimer present his presentation, I have a short bio sketch about him. Professor Albert Wertheimer, Ph.D., M.B.A, is a professor in social, behavioral, and administrative pharmacy in Southeastern University, Florida, the United States and America. And Professor Wertheimer has been active in social, behavioral, and administrative pharmacy research and education for more than 30 years. He earned a pharmacy degree at the University of Buffalo and an M.B.A from the State University of New York at Buffalo, and his Ph.D. at Purdue University. He completed a postdoc research fellowship in the Department of Social Medicine at St. Thomas Hospital Medical School of the University of London and received and directed nearly 100 PhD students and more than that number of master students. He is the author and editor-in-chief, editor of 40 books, and also an editor-in-chief of one journal published by Oxford Press. The title of the journal is Journal of Pharmaceutical Health Services Research, and also numerous book chapters and about 430 journal articles. He has lectured and consulted in about 25 countries, and he holds visiting professor appointment at university in Mexico, Taiwan, Turkey, Slovenia, and also China. He performed pioneering work in the area of social and behavioral sciences in the pharmacy, and in more recent years has conducted research in pharmacoeconomics, outcome research, and healthy policy analysis. And we can consider Professor Wertheimer is one of the well-known pioneer of the social and administrative field in the world. Big applause to Prof. Wertheimer. And prior to his appointment at NSU, he has been a professor at Temple University, also dean in Philadelphia College of Pharmacy, a researcher at Merck & Dome and Company, a vice president of First Health, a pharmacy benefit manager, and professor and director of graduate studies at University of Minnesota. Dr. Wertheimer has received many awards and recognition, including fellowships from American Association of Pharmaceutical Scientists, the highest rank for AAPS, and also the highest rank from International Pharmacy Federation of FIP, where he at some periods be the vice president of the International Pharmacy Federation. He is a Shield Laureate and honorary member of several professional societies. He has been a study section member or grant reviewer for USNIH and for AHRQ. And his current research interests include pharmaceutical counterfeiting, off-label prescribing, and cost-benefit studies. Without further ado, please welcome Professor Albert Wertheimer, Ph.D.
You can use this. How do I get my slides up? Oh, yeah. Publishing or no? The other one, global. Oh yeah. Yeah. Okay. Yes. Yep. I'll be your.
I can do it myself.
Okay.
Good morning and welcome to the program. I'm happy. I'm honored to be here in your high impact series, and it's a pleasure for me to be here and to discuss this area with you. I'm going to talk about outcomes research, and then it's like an hourglass. I'm going to focus that on the general area and how the field began, and then talk specifically about the pharmaceutical components of it as we go through the lecture. And then I'm going to stop and we're going to talk about how do you publish your results when you finished a study. So first of all, what is outcomes research? It's a term that's used to describe a particular line of health services research that focused on identifying variations in medical procedures and associated health outcomes. And this is really new. The first mention of outcomes was in 1996. So a little over 25 years ago. And that's when this all began. Until that time, what happened was that we had what was called anecdotal medicine or anecdotal reports. And I mentioned a little bit of this in a lecture I gave the other morning. You know, if you asked a physician, why do you use ampicillin? He would say, well, my professor told me to use ampicillin and I use ampicillin. And if you ask his students a generation later, they will say, what antibiotic? They say ampicillin because that's what my professor said. But we really don't know if ampicillin is the best drug. There could be other drugs that are more effective. So outcomes research is the technique or the name for the technique that does an analysis that compares others. So we would look at ampicillin and amoxicillin and cephalosporins and see which one actually is the best drug for that condition. And that's instead of just being an example of something that was just passed down from word of mouth by consensus, this is now evidence-based practice. And that's the whole purpose of outcomes research, to find out what's the evidence and then apply it to patient care. Now, when we find out this information, so now let's say we studied a gram-negative sepsis, and we found out that ampicillin was we don't know, but we later found out that ampicillin was the best drug. So this is an example on the screen here of the disease management protocol. So the purpose of doing the outcome studies is when you find out what's the best drug, you also want to know, should it be used for 5 days, for 7 days? Should it be 250 milligrams or 500 milligrams? So you start, and in this case, I have a protocol here for hypertension. It doesn't make any difference. But let's start at the top. We check the blood pressure, and if it's high, see over on the left side, if it's over 140 over 90 millimeters, then we check it again, because for blood pressure, it's important that you don't get just one reading, because sometimes people are nervous one time, or there's something that they're worried about or thinking about. So you test it again an hour later or 2 hours later. If the blood pressure is normal over here on the left side, then you tell the patient to come back in 6 months or whatever is a reasonable time in your healthcare system. Okay. Now, if the blood pressure is elevated, so in our case, we're going to, I used ampicillin first, but let's talk about now a drug for hypertension, and we use enalapril. And so we'll start with 5 milligrams once a day. And then we check up in 1 month, and we find out if the blood pressure now is normal on the left side, then we say, okay, then let's check, come back to the clinic in 6 months. If it's still high, then we add the second drug. In this case, it's a diuretic, hydrochlorothiazide, 12.5 milligrams every day, low dose, and come back in 3 months. So that, what I have on the screen here now is the result of an evidence-based study, an outcomes research study, where we looked at what's the best way to treat a disease. And today, the medical community has these protocols, these templates for most of the common diseases. There's now a best way to treat hypertension, type 2 diabetes, gout, number of the inflammatory rheumatic conditions and other autoimmune conditions that are available now through the various medical societies. So that's the end product. And now a doctor in the most rural, isolated area in some little island way far away from Java and from South Sulawesi, it will have access to this, just like the doctors at the medical center or at the teaching hospital here in Jakarta. So this is a wonderful contribution to the health sciences, and it gets revised. Now, for example, we have here that we use enalapril first. So let's say that there's a new drug that comes out. For example, an ACE inhibitor, angiotensin converting enzyme inhibitor. And so we want to now say, is our disease management protocol up to date? So we do another outcome study, and we look at the new drug, and we compare it to the results of the drugs that we've been using, and we change this continuously. And that's how medicine becomes more and more modern, more and more effective, and we get better outcomes most effectively. So that's what this is all about. Now, the early work in this area is really interesting. There was a surgeon in the state of Washington in the United States. His name was Codman. And what he did was that he looked at the results. The different hospitals published their results, that we treated 50 patients this month, or we treated 100 patients this month. or the patient stayed 4 days, or they stayed 6 days. And he said, well, this doesn't tell us anything about the quality. We really want to know what's the most effective way so we get the patients out of the hospital soonest with the least amount of trauma and get the patients returned to their health status as soon as possible. So he said, we're measuring the wrong things. We need to look at outcomes. So what percentage of the patients who were treated did not have to return to the hospital? The disease was treated correctly or optimally the first time. And that was the contribution of Codman, that we don't have to just look at the numbers, the quantity of things. We want to look at quality. But that was in 1914, and not much happened for a long time after that, even though he told us this should be done. And after Codman, the greatest contributions came from an Armenian physician who moved to the United States in the 1950s or 40s. His name was Avidis Donabedian, and he's one of the heroes in this field, famous up on a pedestal, one of the gods of this field. And he published a study that said that we have to look at the outcomes for anything, that if we don't understand the outcomes, we don't understand the situation. And therefore, we have to go further. We have to describe a series of methods to look at outcomes. And he talked about structure, process, and outcome. He said we do structure already. An example of structure would be if you look at a hospital and you count how many fire extinguishers, these things with the hose to put out, extinguish fires. So if you look at the number of fire extinguishers at a hospital, we can write up this hospital has more fire extinguishers than the other hospital. Now I ask you, does that tell you much? No, because we don't know if they know how to use them, or we don't know if they've had training on them. So the structural methods are not sufficient. And he said, okay, let's look at process. That's the next highest one. Let's look at the hospitals that have fire extinguishers and now see, go to the people and interview the staff and find out if they've been given training and how to use the fire extinguisher. He said, that's better, right? Because now it's not just how many, but are they useful? Do they know what to do with them? And are people assigned a certain station where you go and look for immediately go to the fire extinguisher or get the patients out of the hospital if there's a fire? But that still doesn't tell us the result. Because even with the process and the structure and the process, we don't know if more patients died in that in a hospital that had a fire or fewer. So he said, we need the outcome. We have to find out what the result was. It's not very, we talk about when you have little infants, and you say, my child started talking when they were 8 months or 10 months. It doesn't matter when they started, it's how well they talk afterwards when they're talking. And so he said, using this fire extinguisher example, the most important thing is to look at the records. Whenever there's been a fire at a hospital, which hospitals have the least amount of fatalities? And that's an outcome measure. And we can look at the treatment of cancer. We can look at the treatment of hypertension, of almost any disease. And we can now compare different treatments and different facilities and find out which is best, which is optimal. And that's the contribution of Donabedian. It's a brilliant advancement for us. Now, in England, a man by the name of Archie Cochrane was thinking the same thing. And he published an article in 1972 on random reflections in the health services. And he said, well, how do I know if I'm doing the best? And so Cochrane started a database. And today there's a compilation of outcomes articles at the Cochrane Collaborative. And you can Google it. And they maintain a website. And now if you want to know what is the very best treatment for orthostatic hypotension, or if you want to know what's the best treatment in the world for type 2 diabetes, you go to the Cochrane Collaborative, and you will find all of the articles that used proper methodology that were screened by the Cochrane people in England, and they're listed in their website. And so you can find out what's the best way to do something. And this, so he provided the metrics for us. Now we have a basis for making comparisons. So today, people like myself who do work in this field, we're walking on the shoulders of people like Cochrane and Don Abedian and the others who showed us the way. Now, I think one of the most easy to understand, most brilliant, simple studies is the work of Wenberg. In the United States, physicians are paid more for delivering a baby if they do a cesarean section versus a regular vaginal delivery. So, and there's, of course, there's more opportunities for infection if there's a C-section. There's surgery, they have to cut through the abdomen, and patients stay in the hospital longer. It's more expensive. So he did a study, and it's called small area analysis. And I don't think I have a, yes, I do. So Wenberg's contribution was he looked at the city of Seattle, Washington, and he looked at the hospitals up in the northwest quadrant, and he found out that 16% of the hospitals there delivered the babies C-sections. And he looked at the Northeast and he said 40% were delivered by C-section, 18 in the other corner of the hospitals there, and 21%. So if you look at this, what do you think? It looks like 3 of them, right, are pretty similar, that there's only a need for delivering a baby by C-section around 20% in 3 of them, but there's something wrong at 40% of the patients in that one hospital. So that became his reason for doing further research to follow up and find out why is that one hospital different. And he found out it was the physicians there had the tradition of doing C-sections, and he showed them the data. And later this, I don't have it here, but their numbers went way down to where the others are too, because they saw the reason that it's a lot safer and cheaper to do it the other way. So this is such a simple method that, and we can do that. You can do that, repeat it here in Makassar, or anywhere in Indonesia. It's a very simple way to do an outcomes research study and see why, if there are differences and why. Now, it may be that the 40% was correct. Maybe, I don't know. Maybe the other 3 weren't doing it enough. And so but that gives you the information to go and explore this further. And that's what his contribution was. I think it's brilliant. Now, the term outcomes management itself was used for the first time in 1988 by Paul Elwood, a physician in Minneapolis, Minnesota. And I'm going to read at the bottom here. He said that studying the outcomes of large numbers of patients, including standardized survival, disease status, quality of life, and the cost information, could improve patient care and inform national policy. And that's the ground rules, or the template that we follow today. Now, before that, it was consensus judgment. I mentioned about the professor teaching his students to use ampicillin and the students then teaching the next generation. That was consensus, but it's not precise. It doesn't really give us the best information because things change, and you don't want to do the same thing that people were doing 2 generations ago. So that's why evidence-based practice is now the guideline, the required way we need to do things. Here in Indonesia, you have a government healthcare system, and they pay for everyone's care. And of course, they want to do things. When somebody has a medical problem, you want to treat it right the first time. You want to treat it correctly so it doesn't get more severe and you don't need heroic effects. So outcomes will tell us what's the best, most cost-effective, most therapeutically advisable method of doing something. And we can use this for making purchases. We can use this to avoid errors and to increase efficiency. And that becomes evidence-based practice. And that then informs people. And then we can have a protocol like I showed earlier on the second slide with the hypertension model. Okay. So today, now in the pharmaceutical sector, we've grown a great deal. It's not an infant discipline any longer. We now have our own professional society. It's called ISPOR, the International Society for Pharmacoeconomics and Outcomes Research. They publish a journal, a quarterly journal called Value in Health. And you can Google it and you can find it on the website and read it online. We have other journals in pharmacoeconomics. We have a journal of outcomes research, and we have another one called Disease Management and Health Outcomes. And they all publish the results from studies done here and there. And then by reading them, we can stay up to date and learn the latest, what's the most efficient technique for doing something. So this is, it's a flow chart. It looks complicated, but it's really not all that complicated. But I'm not going to go through every box here, but in essence, we look at the pharmacologic studies, we look at clinical trials, effectiveness studies. We take everything we can, and we try to, from that, create a protocol of a disease management consensus or a evidence-based practice. We publicize it, and then we test it, and we send it out to the community, and then we find out that things have to be modified, and that's why this arrow goes back up to the top, and we revise it, and we continue refining it every time there's a new drug or a new technique or a new technology that allows us to do something differently. So, for example, when robotic surgery became known in the 1980s, it cost more. The manufacturers of the robotic surgery equipment were promoting it and advertising it and marketing it. But the real question is, was it any better than making a larger incision and putting your hand inside the patient? And the results indicated that robotic surgery allows people to make a smaller incision and to work more precisely, but the results were no better. The outcomes were the same. So it cost more, but the healing was faster because there was less tissue damage. And in fact, robotic surgery is not used everywhere, because if you use laparoscopic surgery, you can get the same results. And so we wouldn't know this unless we collected the data from different places, put it together, analyzed it, and see if there were statistical significance between the different methodologies. So that's the beauty, the purpose, and the rationale for health services, for health outcomes research. And this, by the way, never stops. Every time there's a new technology or there's a new drug, we have to say, well, is the new one better? And if it is, where does it fit into this protocol? So it's a continuous cycle, and it goes on and it goes on. In fact, you know, in the psychology field, in the marketing, people talk about destructive or disruptive technologies. And sometimes that's really true. We've been doing something, well, let me give you an example. Yeah, in my country, it used to be 20 years ago, when you wanted to take a trip, you would telephone a company called a travel agent. And you say, I want to go to Singapore. And they would say, okay, there are tickets available at 2 o'clock in the afternoon and 4 o'clock. And you say, I want the 2 o'clock flight. And they would make a reservation for you and take your credit card number and a whole big thing. And you have to go there, or they have to send it to you in the mail. Today, nobody uses a travel agent. When you want to fly, you go online and make your own reservation. And there's a place to put your credit card number in. And that was a disruptive technology. Same with banking. How many of you, raise your hand if you've been to a bank in the last 6 months? Nobody. Yeah. There's no reason to go to a bank anymore. The ATM and online banking has taken care of that. And now, unless there's a special problem or a special issue, you don't go to the bank. So every new technology, every new concept, every new drug, and a new drug I consider to be a technology. It's a new therapeutic modality. So all of these things we have to analyze. And of course, with the ATM, it's obvious that it's so much more convenient. They're located everywhere. You don't have to wait and talk to somebody. You just put your card in the machine, and they could be located all over the city. So these things go on, and it's a good thing. Okay. Now, I mentioned that in that last slide, you get data. Where do you get data? In pharmaceutical outcomes research, most of the data comes from phase 3 of the clinical trial. Now, that's not perfect because it's only maybe 5,000 patients. So if you think about it, there might be an adverse event. There might be a side effect that only occurs randomly in 1 out of every 8,000 patients. And so if we'd had 5,000 patients in the clinical trial, we might not know yet that there's a big problem, but it only occurs in 1 in 8,000. So therefore, the clinical trial information gives us a lot of information, and we can use drugs pretty safely based upon the clinical trial data. But what we have to do is analysis of the post-marketing data when the drug is now used not in just 5,000, but in 500,000 or 5 million patients all around the world. And now we find that it causes something in every 10,000 people and another something. And so this is called phase 4 studies. And most of the FDAs around the world require that the companies report these results, adverse events when they occur. And if they're life-threatening, they have to report them immediately. So this is a portion, this is part of outcomes research. And it's the name of the field is called pharmacovigilance. And there's many jobs in that area, and every drug company now, manufacturer, hires people in this area, and they have to receive the data and analyze it, and to see whether or not there are problems after the drug is available commercially available all over the world. So that's another use for pharmaceutical outcomes research. There are 3 types of outcomes. Clinical outcomes are the kind, does the drug lower the blood pressure? It's either yes or no or halfway. Economic outcomes, we have to look at, and this was not done until more recently, you know, if somebody can't work because they're sick and they're home and they can't, let's say they work in a factory, or they're a dentist and they can't work on people's teeth because they're home in bed, there's an economic outcome. So we need the drug that is going to work the best, the fastest, the first time. And then there are the humanistic outcomes. You know, sometimes there are 2 drugs that do the same thing, but one drug causes nausea and vomiting and tiredness and or other very serious adverse events. So we have to look at the actual idea of outcomes research is that we have to look at all 3 of these things, and this is called the Venn diagram. And from this, find out which product or which technique is the optimal. It may be that the drug is okay, but it has to be used in lower doses more frequently. So instead of 1 tablet every 24 hours, maybe you have to use half a tablet twice a day, or smaller dose 4 times a day. But all these things come about from us trying to improve the system and to make it optimally, both clinically and economically. And I have to admit something to you, a shortcoming of mine and my colleagues in the field. We really don't pay a lot of attention to humanistic outcomes. People care most about the drug working the best, fastest, and they care about the economic one. But the drug companies and the doctors, well, if it causes a little bit of nausea or a little bit of vomiting, that's okay. And so it's not ignored, but it's less of a priority or less importance, unfortunately. But those are the 3. Now, that's essentially how you do outcomes research and do pharmacoeconomic analysis. And now I wanted to spend the rest of the time. So you do a study, and if you've done a study and you've looked at different drugs for treating, a good example is hypertension. We can treat hypertension with diuretics, calcium channel blockers, ACE inhibitors, ARBs, diet, exercise, many different modalities for treating hypertension. So the question is, you found it out and now you have to tell other people. And so you want to publish your results. And now I'm going to talk about publishing data. So I need help getting the other slide set here.
Yep. Ada bisa bantu?
You have a 1 minute break.
Yes.
Yeah, I have water.
Another slide.
Yeah, it's the other slide deck publishing.
During proper timer breaks, you can ask 1 or 2 questions, or we also have participant in the Zoom room.
Oh, it's great.
They also can have direct ask question directly to Professor Wertheimer, or they can also have a chat room that they can ask the question there.
Happy to.
Yes.
Are there any
Do you want
questions?
to-
Yeah, sure. Good time.
Any questions? At the GDLN room or from the Zoom meeting? Otherwise, you can.
Yeah, if no questions, it means I did a good job.
Yes.
Yes.
Please, Prof. Thank you very much for that.
Yeah, he needs a microphone.
I think related with the medical economics, yeah. So do you think we can make it one proposal related with that, how to compare the cost effectiveness of how to treat the one disease like
Sure.
like a hypertension in America and in Indonesia. Maybe that is one idea. I think we can make it one proposal.
Yeah.
Anshar will write the proposal that.
I will. Thank you, Prof.
Yeah, thank you for the question. Yeah, actually, I was thinking before that there's like a couple things came to mind that would be kind of obvious to me. You know, I don't know if you have local remedies, you know, plants here in Indonesia that are used, or, you know, herbal remedies, but that would be a good study to look at the use of the things that the bark or the leaves or the roots of plants versus some of the synthesized products that have come from, you know, that you have to spend money importing. That would be interesting to see whether for a condition, whether they work equally or one's better than the other. Or, you know, in antibiotics, for example, I've always been fascinated. In some countries, in Germany, I think they use antibiotics for 5 days. That's the tradition. In my country, we say use antibiotics, take all the drugs for 10 days. In some countries, 7 days. Which is best?
Yeah.
I don't know. That would be a good because if 5 days is not enough, and then you need a second course, if the infection is not cured, then why only do it for 5 days? Do it for 7 or 10. So that would provide good information. I think outcomes research allows you to question everything you do and to see if it's the best. And you can do that. You can compare it here, different regions or different islands, or here versus the UK.
Yeah, I mean that if there is a publication from the US scientists that how much the cost of the, for example, a patient with the tuberculosis in here, they have to get a treatment for at least 6 months. And I just want to know how much they prepare money for patient tuberculosis in America, and I want to compare in Indonesia. Yeah, so if there is a publication related with that, they already decided how much, and we want to calculate in here.
Yeah,
thank you.
Good. Thank you. It's a good thought. Yeah. Okay. Everybody awake? I'm the editor of a journal. It's called the Journal of Pharmaceutical Health Services Research. It's a quarterly, comes out 4 times a year, and it's owned by the Royal Pharmaceutical Society of Great Britain from England. And this says Wiley, but it's published now by Oxford University Press. and we publish articles about pharmacoeconomics and pharmaceutical outcomes research. So if you do a master's research paper or a PhD paper, I would invite you to think about submitting it to the journal for publication. I don't guarantee that it will be accepted, because my job as editor is I send it to peer reviewers. I send it to 2 or 3 or 4 people who are knowledgeable in the area, and they review it. And then I'm kind of like the referee at a football game. I take this person's review and this person's review, and I try to make a decision based upon what they say. So anyhow, I enjoy my work as an editor, but I've been doing that for 14 years. And along the way, I've seen some silly things and some stupid things. And so right now I'd like to help you so you avoid any stupid things or silly things if you ever send an article to the magazine, to the journal for review, for publication. So some of this you already know, so pardon me if this is too simple or basic, but the purpose of research is to gain new information, and with that information, that will help us establish new policies, government policies about health, or practice policies. This is how you should treat tuberculosis, and it improves the total body of knowledge of science. So today, I can go to my computer and type in a term and find out from the web almost everything that's known about it all over the world, and that comes about by the fact that Professor Dr. Massi and Anshar here and others and myself, all of us, when we do studies, we report them, and they become indexed in the bibliographic organizations, and we can find out what's already been done, and we know not to do something that would repeat old work, or if we already know the answer for it. So we publish research then to advance the field and to give us information to set policy. What not to do, and I see this all the time, and it's a shame because I have to write a letter back to the author saying, I'm sorry, it's not satisfactory. One, nobody cares if you do a survey of the students in your class, in the middle of Ethiopia, someplace, in a small town, and you find out that half the students use this drug and half of the students do that drug. That study is not generalizable. It's only the information from a small town in the middle of Ethiopia. Nobody outside that town cares. Nobody outside wants to know. And nobody in an international journal will bother reading about data that only reflects that small town in the middle of Ethiopia. So not only that, but if you're doing a survey on your students, they're not pharmacists yet, or they're not physicians yet. They probably don't know enough. Why question students when they're not finished with their study? So don't even send it to a journal. It will be rejected. Okay. You're thinking of doing a study, and you notice you do a literature review, and you notice that the study has already been done in 6 different countries. Well, I'm guessing that the world does not need a 7th one, that 6 is enough. Maybe 2 is enough, but somehow 6 were published. So unless there's something very special about the environment or the weather or the climate, or there's something that certain diseases are endemic in a certain area, if it's already been done several times in first world countries and second world countries and tropical countries, don't bother. Okay? I'm not trying to be insulting. I'm trying to help you avoid mistakes and getting disappointment when they tell you, I'm sorry, we will not publish this. Okay. There's 2 types of research. There's qualitative research and quantitative research. Now, this gets my wife upset because she thinks that there's a good reason for qualitative research, but I don't agree with her. And qualitative research takes a group of people, maybe 50 people, and they interview them. And then they write up a report that says some people thought this, some other people thought that, and And here is a good quotation from one person. And I look at that and I say, what does that tell me? Because I think that before you can understand anything, you need to know the numbers. What's the size of it? What's the impact of it? What's the shape of it? Francis Bacon said, you don't understand anything unless you can describe it numerically. And so that's quantitative research. So I get manuscripts coming to the journal, and I'm sure all the other journals do too, that are qualitative studies that said, a few people thought this, some other people thought that. Well, it doesn't give you any guidance. It doesn't help you with policy. It doesn't help you improve practice. So almost all of those qualitative studies they get rejected and they get sent back to the author. They don't even, it doesn't even get sent out to the peer reviewers. They're just rejected immediately because publishing them doesn't help anybody except the author gets a publication. They can tell their dean that they had one more publication. Okay. The other thing is that if you're doing something, an intervention, you're trying a new drug, a new technique, you need a control group and you need to randomize. And those are two very basic components of a scientific article. So if I write up an article and I gave ampicillin to 50 people, and I wrote up that 49 of the 50 had the disease cured, the infection went away, well, that doesn't tell me much. But I want a study that where it compared 50 people who took ampicillin to 50 people who used amoxicillin, or 50 people who used benzyl penicillin or something like that. Then I can see which one worked better. So there has to be a control group, either a separate intervention or no intervention. So for example, right now there's a number of interesting studies where people are looking at the incidence and the prevalence of COVID infections for people who have been vaccinated versus a group of people who have not been vaccinated. That's good, because there's now a group to compare, and the result is you'll know what the impact of the vaccination was versus no vaccination. That's a good study. But just to report on a bunch of people who were vaccinated or who were not vaccinated doesn't tell you anything. And the same thing is you need to randomize the population in the sample, in the sample that you're going to use. So my example is, if you wanted to test something someplace, it's good you could use the people in this room but you still need then the people in Java. You need some more people in the sample who are in Java, and you're very young. So maybe you need some older people and some middle-aged people. So you want to have a sample that reflects the population, because if you can't generalize it is the key word. An article has to be, an article is of value and important if you can take the results and say, okay, that's probably what would happen in my community or in my city or in my region. But if it's only specific to one age group or one population or one area, then it doesn't help anybody. So you want to randomize it by mixing up the people in the study. And randomization is achieved. If I were doing a study, I wouldn't pick, if I asked all of you to participate, that's called the universe. That's 100% population, 100% sample size. But I don't need that. But I would look in a book, or now you can go to the web and type in randomization, table of random numbers, and you'll get a list of numbers that were computed by a generator. And it'll be 1, 5, 9, 14, 22. I don't understand the math, but it will tell you. So then I would pick number 1 and number 7 and number 14, and that would be my randomized sample. And I would exclude the rest of you. So a good study, the qualities that you need to look for in a thorough, proper, a good quality study are randomization of the population or of the subjects, and that there be a control group or something to compare the intervention to. Okay? Any questions about that? So basic, essential. Okay? Okay, where do we begin? Well, you begin with a literature review, because it's really a shame for you to waste 3 months doing a study, and then you submit the article to a journal, and the reviewers who are knowledgeable in the field, hopefully, will say, this is a nice study, but it's the same thing that Abdullah did 2 years ago, in Malaysia. And there's no need for this article. Your results are the same. So you do a literature review and you find out what's already been done. And maybe what you originally planned on doing has been done, but by reading the other articles, it'll give you an idea that if you do something 20 degrees a little bit different, or change some component of it, that has not been done. So you want to know what has already been done. And then in most journal articles, there's a little bit of an introduction or a background, and you do that in a chronological way. Like when I started my lecture this morning, I talked about the early work by Codman and then Donna Bedian, and I went and brought it to the current time with Elwood and the latest studies. So you want to, in your article, talk about what's already known. And that section should end with, in spite of the fact that all of these studies, we still don't know whatever you're going to do. And then you describe your study. And that's the first two parts. It's like a dissertation. The first part is the background and literature review, and the second is your methodology. Okay. I just said that. So at the end of the review, you say, and even though all of these have been found, we still don't know whatever you're going to talk about. And that's your research endeavor. Okay. Two types of research designs that can be used when you're going to do a study: descriptive and experimental. And I want to say that there's absolutely nothing wrong with descriptive. Experimental studies usually have a hypothesis, and you test a hypothesis, and it sounds more scientific and more higher level of sophistication, but descriptive studies are important and needed too. A descriptive study, if I wanted to do a descriptive study, I would ask each of you in this room, how tall are you? And you would tell me 1 meter 8.8, 1 meter 5, I don't know, whatever. And I would go around and I would find the mean, I would find the average. And I would write up an article saying the average, I would divide it by men and women. So I would say the average men were 1 meter 8 and the average women were 1 meter 3. And the difference is 0.5 or meters or whatever it is. The numbers are not important, but that's a descriptive study. So if I were a clothing manufacturer, I would want to know what the average man and the average women were. So it has value. And the same thing for if I was designing a drug. I would do that with weight. How many kilos does the average person weigh today? I bet the average person today is heavier than the average person 30 years ago or 40 years ago. Life is easier. We have now more snack foods available and bad foods and chicken satays. Yeah. So anyhow, so those are descriptive studies. They're perfectly logical. They're publishable. Nothing wrong with them. Never to be ashamed of them, and they're okay. And that's my example. An experimental study just uses a hypothesis, and you generally you may intervene with an intervention, or you may go and find something in the databases or in the literature. I'm going to talk about that next. Well, I'll do it now. Yeah. So if you're going to do a experimental study, there's two types. Both are 100% okay. Both are publishable. Both are acceptable. Both will get you a degree. The first one is a prospective study, and that's when you're collecting the data yourself. So let's say you're looking at I don't know, a type of cancer. So you're working at the hospital, and every time a new patient is found with that cancer, that you interview that patient or you follow their therapy. Okay, so you're creating the database yourself by recruiting each patient into the study and asking them questions or evaluating their therapy. A retrospective study is faster, cheaper, and easier. That's by finding old data. So the hospital has lots of records. They keep records of every patient. And now you want to find out, did the patients at hospital A do better than the patients at hospital B? So you need to go to their records and then make a comparison. So that's a retrospective study. So prospective studies cost more money because you have to recruit people and it takes time, and it takes much longer. And you might find problems. Retrospective studies, easier, faster, cheaper, but they may not be exactly what you're looking for. So if you wanted to find out the treatment for what's been done for triple negative breast cancer, for example, you may find that there's only a few people who have that type. The others have HER positive or HR negative. So you may have to keep looking for more and more records, but either both have problems or can have problems. Both are okay. Okay. So you want to do a quantitative study, not necessary. It could be that it be experimental, could be descriptive, and it can be retrospective or prospective, both okay. I think that's it. Yeah.
Okay.
I'm done.
Okay, give applause for our time. Is there any question from this room or from Zoom, our Zoom meeting? The participant from Zoom meeting can also directly ask for questions. Just open up your microphone and then Wertheimer will hear your voice. Di ruangan ini ada yang ingin bertanya dalam bahasa Indonesia juga, oke? We will try our best to translate your questions and ask to Prof. Wertheimer. There are some colleagues from the lecturer from another faculty in Universitas Hasanuddin, and also a friend of mine from University of Pajajaran in Bandung.
Okay.
Today. And also there are colleagues from another faculty, like Faculty of Medicine, Faculty of Forestry.
I don't.
Also, most of them from Faculty of Pharmacy.
I don't know anything about forestry.
Answer.
And also, yeah.
Yeah.
Yes, Pak. Yes.
Sorry. You show us your journal.
Yes.
Can you see again? Yeah.
I can leave it.
Yeah,
there.
yeah. I mean, I guess that so many researchers all submitted their paper to your journal.
Mm-hmm.
So the thing is, I just want to know, because we really want to increase our quality of our journal. So is there any chance to, how to say, to submit that article
Sure.
Reciprocal? It's mean that our article sent to your journal, and some of your article can be published in our journal. Is there any chance to see like that? I mean that you recommend some of your article.
I know, I understand the question, and it's a good idea. I have limited authority because as the editor, I send the article out. It's a peer reviewed journal.
Yeah.
So I need to get 2 peer reviews, minimum of 2. And sometimes, even though I like the article or I like the author, the reviewers tell me that we shouldn't publish it, that it's lacking, something or the other way too. And the journal is owned by the Pharmaceutical Society. So I think I would be happy to recommend an exchange, but I can't say so. It has to be the people who own the journal.
Yeah, I know.
Who would make an MOU with you.
Yeah. Should be like that.
But I can make recommendation and
Yeah.
sure. Happy to do that.
Thank you very much. But
Yeah.
anyway, we will how to say, announce to our lecturer or our student to submit to your journal, if possible, that they can accept it. And after that, let's we try to see if there is a chance to answer. You have in Faculty of Pharmacy, there is a one journal, I think.
Yeah.
Already Sinta
3.
Sinta 3.
Yeah.
Oh, I mean that's how to say, from your student. I mean, no. From your student, if there is, they want to publish this simple article.
Yeah. My journal has 3 possibilities. One is a full research article. The other one is what's called a short report, and it's maybe 1,000 words. And it doesn't have to. Most of those things are master's dissertations, master's papers, and Ph.D. studies could fit into that one. And then we also accept review papers. So someone might want to study what's known about a field or the history of something or the development where we are today, and we take review papers with or without meta-analysis.
Thank you.
Sure.
Thank you, Professor Nasrum, for your questions.
Yeah.
In a Zoom meeting, we have Dr. Muhammad Akbar, our colleague, faculty member in Faculty of Pharmacy. He's doing his postdoc in Szeged University. Where is Hungary.
Hungary, yeah.
And Dr. Akbar will ask a question to you. Please,
Great.
Dr. Akbar.
Yeah, thank you very much, Mr. Anshar. Thank you very much, Professor Albert Wertheimer, for your great presentations. It's really an honor for me to listen to your lecture directly. I read one of your editorial in the Journal of Pharmaceutical Health Services Research with the title of Predatory Journals and Conferences. And I see that based on your years of experience in research world, you might aware and notice that there's a shifting in our academic world in which publishing more articles becomes more important than the quality of the papers in the academic performance review. And I agree with you that what you wrote in the article, that perhaps the problem is deeper and more serious because it involves how our academic system is run right now. In Indonesia, we also highly rely and focus on the number of publications in the university or faculty level. Even in the faculty level, there is a publishing target that needs to be hit every year. And it's like an hedonic treadmill for us. Like since when we achieve the number, next year there will be a higher target, and so on. Since you are currently in our Center of Research and Community Services, may we have your suggestions on how can we improve our publication numbers, but still guarding the quality of our publications so that we can also still compete in the international level. Thank you very much, Professor.
No, thank you, and it's nice to hear from you. I heard good things about you, so thank you. Well, you're not the first person who is worried about this problem of this publishing and the diminution or the decrease in the declining quality because of the required numbers. My university and most of the universities in the States now will only give credit to articles published in legitimate journals. In the last 10 years, there are thousands, maybe 10,000 journals that have sprung up that are for-profit. We call them predatory journals, and they charge money to the author to publish, and they guarantee, even if they say peer review, they tell you it's approved in 2 days, and we take 6 weeks or 8 weeks, sometimes longer. So the universities do give no credit. It doesn't count towards your requirement if you publish in one of these for-profit journals from India or wherever many of them come from all over. And so that's intended to discourage people from doing that. The other thing that some of the more advanced universities are doing are not counting the number of articles, but they're looking at the number of citations. So if you did a paper and it's really important, it's likely that people will cite it in their future papers. And so there are citation indexes, as you know, where you can find out how many times a paper has been cited by authors and in which journal. So a paper that's been cited multiple times should be worth more than a paper that has no citations or only has one citation. So I think that would help, but the universities have to come up with a better metric. And in my academic department at my university, the old chair, fortunately he's not here, he doesn't hear this, but the old chair would require 2 publications a year. And I never had a problem with that, but some of my colleagues who did not do any research somehow found something to write and publish 2 a year, even though they really added nothing to the body of scientific knowledge. So an article should come as a byproduct, as a result of a research study. You do a study and then you share the results. But to do a publication with no results is not meaningful, in my opinion. So he's not there anymore, and now we require research. But I think that the best way is to, and there's no reason why you can't consider that here at UNHAS, to modify the number required, but to add, some bonus for quality for the number of citations. Because if the paper is good, there'll be a lot of people citing it. And if the paper is not important, there'll be fewer. So that really tells you a lot about the quality of the paper. That's my only ideas. But thank you it's a great topic. And good luck in your work there in Hungary.
Yeah, thank you, Professor. Enjoy Makassar.
Thank you.
Thank you, Pak Akbar, for asking the questions. There are another question from the Zoom chat room from Dr. Sri Endang Sukarsi. She said that this webinar is very interesting, Professor, because it encourages high research impact. What is the strategy to achieve high value research result? Thank you. Yeah.
Terrible question.
Yeah. Well, there's a famous quote that says, "No pain, no gain," and I'm not trying to be silly, but you have to try things, and sometimes they don't work. And if the university should accept, any and all universities should accept that you made a good effort and you tried something, but it failed, or it's like in chemistry, you try to synthesize something and you try, but it's beyond your ability, or you don't have the apparatus or the skill, but you should get credit for trying. So just as well, it used to be the case that people were only encouraged to publish positive results. The drug worked better than the older drugs. But today, most universities in North America and Western Europe, for example, now require that if a study is published and it shows negative results, they still have to be published. So sometimes the research is supported by a drug company and they paid you money to test their drug. And now you find out that the drug is inferior to the ones that are already available. The universities require you, the company cannot not stop you from publishing that. And that's honest and fair. So that's important. So even if you don't have positive results, or even, that you did some study and there's no statistical significant difference between what you found and what's the usual and customary therapy, you publish it, and that should be equal credit. Yeah. If it's publishable. Yeah.
So no pain, no gain.
Right.
Okay. Another question from this room, and from the Zoom meeting. we also have Oscar. Dr. Oscar is our colleague from School of Pharmacy in Universitas Jenderal Ahmad Yani in Bandung. He asks about, I have a plan to publish my dissertation in your journals. My first question is, I want to ask about research in the multi-center, but in one area. For example, in one province in Indonesia. Can kinds of journal be published? And the second question is, if I have a survey, participants are pharmacists who work in hospitals. My theme is cost containment in Indonesia. What's your opinion about that, Prof?
Well, that's a tough one. If it's multi-centered, in other words, you're asking people at different locations, that makes it better. And asking pharmacists to complete a survey is good, as long as your sample size is sufficient. You probably know enough about that from your statistics course, that your sample, you have to calculate an acceptable sample size, and there are formulas for you plugging in the number of variables you have, and that will tell you what the sample size requirement is, or you can do it through power analysis. But when you get the right number of people in the sample and you randomize the pharmacist that you're going to interview, and you do it at multiple locations, it's very likely you could get the article published someplace. You know, I've done this myself. I've had an article that some research I wrote, and I submitted it to a journal, and they for one reason or another, it wasn't exactly the focus of that journal, or it was not sufficiently sophisticated, or whatever. And they said, I'm sorry, Professor Wertheimer, but we will not publish it. There's nothing wrong with sending it to a second journal, another journal, and you try to get it published where you can. So that's okay. And, you know, it might be your third journal, but what you just described is probably very publishable. And I wish you success.
Okay, thank you, Prof. Do you have a follow-up question, Dr. Oscar?
Thank you, Mr. Anshar. Maybe I I will try to do your advice. Maybe I still try to conduct my research now. Maybe I will send to you the research maybe 6 months from now. Thank you. Maybe I will do my best.
I'm sure you will.
You will.
Yeah.
Thank you, Oscar. Okay, maybe Isra, please, Miss Isra.
Okay, thank you very much. I want to ask about your presentation before. The point is what not to do. In the second point, you said that duplicating studies already done in 6 countries. Can you please explain more about this, because I'm still confused what actually this word means.
Okay.
Thank you.
Thank you, Isra.
So let's do the second part first. Let's say that you're testing the impact of a group of drugs called statins, which lower LDL-C, lower cholesterol levels. And and there's a study that shows that they work in Germany, another study that was done in Australia, and it says that statins lower cholesterol, and one was done in New Zealand and one in I don't know, Egypt. So there's no question statins work, and they work in different populations. So there's no need to do it in Indonesia. We already know that category of drugs works in lowering cholesterol. So you may want to do a study to find out whether the dose is required. It might require a different dose in Indonesia. You know, the different people around the world have different enzymes and different metabolism, and so just like the Japanese require that clinical trials be done in Japan because the Japanese population is can be somewhat different from the population in North America. So you could do a study to see if there's a difference in what's the minimum required dose to get an effect, or what's the optimal dosage, but not just to do a study to show the same thing that the others did. So but there's always, if you think about a question, you can always find some way to do it. So let's say that the study's been done 6 times. Now you want to go back and see whether maybe one of those drugs work better in women than men. So you want to do a cohort, you want to break down the sample. That would be a great retrospective study to look at the data that's already been collected and separate the patients into postmenopausal women, premenopausal women, men of different ages. Most youngsters don't take cholesterol lowering drugs, but anyhow, you make several cohorts and then see whether the drug works better in one group than another. That would be a great study.
As long as it doesn't depend on the geographical. I mean, for example, like you said before, that for example, like the dose of the drug sample, as long as maybe it's success in Japan, it doesn't mean it's a little bit more different in Indonesia. I want to like conclude with your answer. Is right?
Yes, that's correct. Yeah, I mean, for example, the people in Asia, many descendant from Han ancestry, ethnicity, and and you have people of Malay and different ethnicities, and it may be that they process drugs. There's a lot of literature showing that drugs are processed differently by different people, and if it's sufficient to show that you need to change the dose, then that's a good study. Yeah.
Yes. Thank you, Prof. Thank you, Isra, for asking the nice questions. We actually have one question from the chat room.
Okay.
It's from Anggreni, our colleague, also from Faculty of Pharmacy. She is a staff member of our faculty. She asks, she said that thank you for your interesting presentation. What if a researcher want to publish a journal about COVID-19 that uses old data from 2021, and that is no longer relevant to the current situation? They use only one guideline that was available at that time, that was issued by a specific organization to assess the suitability of therapy, while there are more recent guidelines for now.
Yeah. Well, first of all, thank you for the question. Actually, that's a great study. In the early days, people thought of COVID-19 as a respiratory illness, and they put severely infected people on a ventilator, and they didn't realize that the pressure from the ventilator was destroying the inflamed lung tissue and actually doing more harm than good to many of the patients. So that would be a neat study to show how knowledge advances and how guidelines evolve as we learn, and how we learn is exactly from experience. So treatment for COVID-19 today in 2020, almost at the end of 2022, is very different than it was in 2019, and that would be a good study to show the evolution. We think we know a lot, but we really don't know as much as we think we do, and that's a good example to show how treatment today is far superior than to the other one. It's a very good idea.
Thank you, Prof. Thank you, Ibu Anggi, for your questions. In the chat room, in the participant, we have also Professor Ardo Sabir from Faculty of Dentistry, and also Dr. Yulia Yusnita Rifai faculty member in the head of postgraduate program in faculty. Do you have any thoughts, Prof. Ardo or Dr. Yusnita, about what Prof. Wertheimer said or explained? Do you have any thoughts or any questions? Please.
Thank you, Dr. Anshar.
Yes.
It's my pleasure to can join this webinar. I think the presentation of Professor is very interesting and it's very useful for us. So how to make more to increase our quality of our paper. I think that's all for me. Thank you. Thank you.
Thank you, Dr. Professor Sabir, for your interesting thoughts. Thank you very much. Dr. Yusnita? Maybe no. I have one question to be a representative of the beginner researchers in social pharmacy in undergraduate students.
Okay.
If you have tips, if you have an advice for them as a beginner researcher in social pharmacy field, social and administrative field, what that will be for them?
Well, that's a tough question. I mean, the field has so many areas and branches, and epidemiology, so the behavioral sciences, economics, quality studies, and then all of the things like Professor Dr. Anshar, Mr. Anshar and I are working on something on counterfeiting, counterfeit drugs, and trying to find out the economic cost of that. And almost any area provides a good opportunity to do research. If a student came to me and said, I want to do some project with you, I would say, I just off the top of my head right now, I would say, why don't you compare the different, how drugs are approved in different countries by the different FDAs. So, for example, in my country, a drug is approved permanently. It has what's called a new drug application is approved. In Japan and a number of other countries, the drug is approved for 3 years, and then the company has to look at the results that come in from the pharmacovigilance and make an application again. And I'd like to see which is better. I bet they have fewer drugs that are removed from the market because of bad events. And I'm sure that there are other countries that have different other strategies for approving drugs. So that's one thing that would be a nice study. I don't know if anybody has done that. I still like the biggest, most expensive waste as a challenge is compliance. Yeah, because patients go to the doctor and they go to the hospital and they get the prescription and they get the laboratory work, and then they don't take the medicine, and that's such a waste of everybody's time and money, and the condition gets worse. And so there needs to be more studies to find out what is an effective means of getting people to take their medicines when they're supposed to. And I mentioned the other day, there's just recently, some people have experimented with actually paying the patient. If they take the medicine for a year correctly, they use all the pills, take it every day, that they get a gift card or something like that for Starbucks or someplace. Well, it works. Yeah, it's an incentive.
Okay, thank you very much, Professor Wertheimer, for your very thoughtful, inspiring explanation about the outcome research and also how to publish in article journals reputable. And maybe we are at the end of this meeting, and we want to say thank you very much again for your teaching today, for your lecture today to us. And also I want to say thank you for the all participants in this room and also in the Zoom meeting. And the former, I want to thanks also to the Professor Massi and also all the staff, the bright staff here for making this webinar would be perfect, hopefully. Okay, thank you very much, and give a big applause to Professor Wertheimer. And hopefully we can see Prof Wertheimer tomorrow. There will be a scheduled webinar and a seminar with the speaker of Professor Albert Wertheimer, and also we have a second speaker, Dr. Joachim Seradel, Ph.D. M.Ph. We will have a good talk about outcome research, and also the pharmacoepidemiologic thoughts related to the public health, and also
I'm doing pharmacoeconomics.
And also doing about pharmacoeconomics. Tomorrow at 9 o'clock, we will tell you the place. We plan it in Senate room UNHAS, the second floor of the rectorate, and we will invite all of you again in this room and also in this Zoom meeting to attend that important meeting seminar. Thank you very much again, and then I will give this microphone back to Ms. Alia. Thank you very much. Big applause, all of us, for all of us. Thank you. Please.
Okay, thank you very much to our speaker, Professor Albert I. Wertheimer, PhD MBA, for the valuable knowledge and his time. And also thank you to our moderator for guiding this webinar very well. Ladies and gentlemen, before we officially close our webinar, we would like to invite Dr. Anshar Saud, S.Si M.Farm pharmacist, and also Professor Albert I. Wertheimer to give a merchandise to him. So please, maybe Ms. Isra could help us to present the certificate and also the merchandise from Universitas Hasanuddin. It's okay. Maybe. Yeah. And also maybe after we give the merchandise and certificate, we can have a photo session together with all the participants here. Okay, we also have like a placard from Universitas Hasanuddin. Okay, maybe it's like a photo frame of our rectorate building, I guess. This is our rectorate building. It's a placard from Universitas Hasanuddin. Handshake. Okay, so I invite all the participants of this webinar to come to the stage for having a photo session together. Ya, adik-adik mahasiswa mungkin bisa maju ke depan.
Oh ya, ada itu yang flyer yang ini.
Oh bisa.
Itu di mana tuh?
Nanti saya share
Ya,
screen.
coba buka ya. Supaya ada tulisan gitu.
Ya.
Iya. Lebih besar lagi mungkin lebih bagus. Ditutup dulu kali itu yang ini ya. Bisa ditutup yang di sini. Dikasih full.
Atau dari Kak Taming, saya kirimkan Ki. Kak Taming, saya kirimkan Ki, Kak.
Iya. Iya.
Okay, maybe we are preparing for the background first.
Itu oke juga kayaknya. Udah oke. Yes, please. That's okay. Oke, ya.
Silahkan. Silahkan.
Ya.
Once again, thank you very much for our speaker today, Professor Wertheimer, Ph.D, M.B.A. Ladies and gentlemen, everything is awesome today. We finally come to the end of today's agenda. We apologize if there were any mistakes during this webinar. Thank you so much for your attendance and attention. See you on the next occasion. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh. Have a good day, everyone.
Waalaikumsalam.
Okay.